Mr. Richmond, Ms. Cash,
Here.
Ms. Zipsey,
Here.
Ms. Miller,
Here.
Ms. Lawley,
Here.
Mr. Bunnell,
Here.
Dr. Zala.
Here.
Do we have a motion to excuse Mr. Richmond? He's the only.
So moved. Oh, second.
All in favor? All opposed? Okay, motion passes. Do we have any citizen comments this morning?
Oh.
Mr. Richmond has arrived. Hearing no citizen comments, we will move on to the minutes. Any questions or comments about the November 2023 minutes? I appreciate you guys being super on top of all the time. Thank you. Okay, do we have a motion to approve the November 2023 Board of Health minutes?
So moved. Second.
All in favor?
Aye.
All opposed? Okay, motion passes. The financial report for November 2023, any comments or questions on that?
I have one comment. We are changing over, we have changed over to a new financial system. So we are not sure what all of those reports will look like, but they may look different starting in January. So be prepared. If it is, we'll present it in January, but everything is electronic now. They're trying to do everything scanned and electronic, and so we don't know when the financial reports will actually be completed and done. We're told that everything should be current, like day-to-day current. So if a check comes in today, then it should be noted today. It's not. So we'll see. So that's just a heads up, but other than that.
Okay, do we have a motion to receive and file the November 2023 financial report?
So moved.
Second. All in favor?
Aye.
All opposed? Okay, motion passes. Education presentation from Dr. Dunlop. Good morning.
Good morning. So today we're going to talk about whooping cough.
Right.
So whooping cough, I mean, most of us probably heard of it, had kids with it. First discovered or described, I suppose you'd say, in 1578 in a Paris outbreak. 1906 it was discovered the bacteria was Bordetella pertussis. First vaccine became available in 1938. Really didn't catch on until 1942 when they combined it with tetanus. At that point, there became a pretty big push for vaccination across the United States. Dropped rates significantly into the 50s and 60s. It's commonly referred to as the 100-day cough, because essentially it's 2 to 3 months of this nagging, hacking, sometimes violent cough. Highly contagious with aerosolized particles with cough or sneeze. This is an odd one that most cases occur during the summer as opposed to the common flu and cold season. And it really is a priority or greatest importance in young children, particularly under age of 1. Vaccination, we'll talk later, really can't start until 6 to 8 weeks old. It's a series of 5 vaccines total. So the young kids are really at risk because A, they're not really covered, and B, they get the most ill from the disease. So 38% of all cases are under age of 1, and 71% of cases are under the age of 5. Symptoms, pretty much like a typical common cold at the beginning: runny nose, mild fever, mild cough, but it progresses as you get into week 2 and 3 into these coughing fits. They call it paroxysmal, which means they kind of come and go as opposed to a common cold where you're kind of coughing throughout the day. These come as pretty violent fits that can actually break ribs, tear vertebral arteries. There's some well-described cases that the coughing is so rough you throw up. It's kind of a classic hallmark. You get this coughing fit that ends in vomiting afterwards. And then that violent coughing is finally over, you take that big deep breath in to catch your breath, and you get this whoop sound. Again, particularly in kids, but even in adults, that's again kind of a classic hallmark symptom. Diagnosis is mostly by the clinical signs. Testing is available, but most of the time by the 2 or 3 week period, the tests aren't coming back positive anymore, and that's what people are kind of reaching out for. Why am I still coughing 2 or 3 weeks later? The vomiting is a big one that you look for. That alone is about 50% diagnostic, that if they're having these coughing fits followed by vomiting, probably have pertussis. So treatment prevention. Since it is bacteria, we do use antibiotics. The problem is you've got to get to it fairly quickly. So again, 3 weeks within the onset for adults. Most of the time they're coming in, or a lot of the time they're coming in after that. 6 weeks because of the high risk with a pregnant woman and the soon-to-be newborn child or kids under 1. You do extend that out and treat them up to 6 weeks, just to kind of be sure that it doesn't turn into something more problematic. Vaccination, there have been the wholesale vaccination, which came out in the 1938, very effective, but at a high rate of, relatively speaking, at a high rate of complications with encephalopathy and seizures. Eventually in 1991, they came out with an acellular vaccination. Thought to be at the time just as effective with a much, much lower risk of side effects. It is, like I said, it's a series of 5 vaccinations. You start as early as possible. Vaccinating earlier than 6 to 8 weeks is not proven effective. The immunity of the child just doesn't seem to pick up on it. So you start at 6 to 8 weeks, and that first 2 months is when you really are worried. One vaccine starts to give some immunity, so kids older than that do start to have some protection, but they're really not fully protected, or at least best protected, until they get to about 3 vaccines in. That first series of 5 is all to be done within the first year, and then a booster when they're teens. One thing with the acellular is over the years has proven not to be as effective as the wholesale vaccine rate. And there's been a surge of cases coming into the 90s and the 2000s that they realized protection was not lifelong. So there is an encouragement for in the teen years to get a booster of that same vaccine. Pregnant mothers are the biggie. The hardest push is to get pregnant mothers late in term to get that vaccine, because that gives the antibodies to the baby to protect them for those first few weeks after birth. Cocooning has been a push pretty hard too for many years, decades, with the idea being if you vaccinate everybody around the baby won't get exposed. So we vaccinate the mom, the dad, the siblings, grandparents, everyone involved. That was, again, big in the 90s. By the time mid-2010s, 2015, pretty much has shown not to be effective. Because, again, as the acellular vaccine has been out longer, turns out it does not prevent infection, does not prevent transmission. So you're likely to still get pertussis, kind of like COVID. You're just not going to be nearly as sick, maybe asymptomatic, but still can transmit it. So kids of people who have been cocooned still have the same propensity to get pertussis as those who are not. Still pushed by most obstetricians, but not really effective. The prognosis, most people have full recovery. You don't have to be treated with antibiotics. You'll recover on your own. You'll get over it, but it might be 100 days. Antibiotics do speed up the recovery, especially if you get them early. Again, the focus is on young kids, infants less than 1, particularly those who haven't been vaccinated or haven't had a chance to be vaccinated yet. Complications are 31% of those kids will get apnea, which is spells of stopping breathing. 12% will develop pneumonia, 0.6 seizures. Pretty high mortality rate for kids in this age group, with up to 2% being fatal. Those kids under 1 account for 96% of all the deaths from pertussis. The reason we're talking about it today is there was an outbreak in Ohio, really nationwide, but Ohio in November was the leading state in the United States for cases of pertussis. 603 cases with the normal. Last year we had 117 at the same time frame, so it was dramatically higher than years past. As I said, the largest number of cases in the United States. And Warren County was one of the hottest counties in the state. We had 14 cases alone in November, compared to Butler County had 5. So it was not broad spread across the state. It's kind of pockets of pertussis throughout different counties. And that is and I thought it was a great topic when that came out last month, but it seems to have died down for December, so it's not although I haven't seen December's numbers, but it seems to be calming down as far as an overall outbreak this month.
Do these babies get all these 5 shots? I mean, is that pretty routine when they go to?
The vaccination rate, I think, I didn't see a specific number, but most of the time it's into the 60–70%
Really?
kids. Yeah, it's pretty high.
Although the last couple of years, vaccines for kids have been waning.
Waning.
Yeah, only because of, they got off
Well, that's fair.
schedule and COVID and whatever, so a lot of kids were behind. A lot of kids were missing or behind.
I think a lot of, yes, maintenance, medication, maintenance, medical maintenance care went by the wayside. And then you do get a lot of people, more people are vaccine hesitant as well as all of a lot of complicated factors.
Another thing I think is interesting, Warren County always is a hot spot for infectious disease. And I think it's because of the high-class travelers. Because that's where we're seeing all the COVID and everything, and it starts there, it's that hotbed. So we have a lot of professionals that travel quite a bit from Warren County. So I'm wondering if that's gonna be a trend, because it seems like everything happens like in Warren County. And Warren County is very, I mean, when I
Do you
say
think
that.
they're getting tested more regularly,
I-
like access to medical care?
I think it might be all of the above because they are pretty much affluent people. But with all the COVID, it started in Warren County, it was just because they were travelers and they weren't as cocooned down as most of the population. And so we'll just see that, but it just seems like it's really, and then they have a lot of international type of people that I think that comes in. They have a lot of high rates of TB and that kind of stuff because of different, yeah, so. When I speak to Dwayne all the time, it's just, and then you're right there in Warren County, you probably see all of it. Emily too, don't you? Yeah, so it seems like it's just, but yeah, I think it's a combination of that too. Good healthcare, testing when they're sick or whatever, so. And then the schools there would make sure, so, all of the above.
Dr. Genowine, what does the medical community have to say about the borders that we have and all the immigrants coming in and our?
I think that they have, for the most part, stayed away from that topic.
That seems
That's very
pretty
politically
scary
answered.
to me. We don't know what's coming in and that kind of thing. We could get all kinds of diseases.
I think that just in immigration in whole, not just illegal immigration, but immigration in whole, when you've got a world where there is travel, business going back and forth to all different countries and different areas that may still have hot pockets of certain infectious disease that the United States isn't used to seeing or dealing with, that can create a problem. Definitely contributes to.
And I had heard when they come through the right way, the right process way, they're processed and immunized and they're getting everything. It's just the ones that don't, yeah. So that's all my,
Yeah,
when we
you're
talk in the nursing.
required to provide shot records in most
Yeah,
cases.
so when they're coming through and if they're through the process, they get all their shots, they get all their, yeah.
I
So
sure
it was the
didn't
ones
know.
that, yeah, it's the ones that may not come through that way too.
Okay, that's my presentation.
So pertussis is that the same thing?
Pertussis is the name of the infection disease because it's the name of the bacteria
Okay.
that causes it,
Okay.
Bordetella pertussis. Did I have that on there?
Yes.
Yeah.
Okay.
You probably
Couldn't remember myself very good. So that's how it became named pertussis.
And underneath this, we're seeing, just this year, a lot of respiratory illnesses. I know that a lot of people were concerned about the pneumonias being more COVID. People are being hospitalized a little bit, so we're just seeing a lot of respiratory stuff. Emily, do you have
Yeah.
any, that's pretty much?
Yeah, we're definitely seeing an increase in hospitalizations from COVID right now.
So, I mean, it's this respiratory, a little
Yeah.
season type thing too, so that's good presentation at that time, because there's so many things out there. All the parents are talking about either pertussis, pneumonias,
RSV,
yeah, RSV, a lot of
Yeah,
them
but
are
RSV, isn't that just a common cold?
pretty much.
Yeah, I mean, I saw something, or I read something where it said, you know, for most people, getting that shot really doesn't do anything. I mean,
No.
It's not worth taking.
If you look at
Unless you're old,
Pfizer's,
real old, or you have a lot of illness or whatever, other than that, don't bother.
or again, young kids, very young
Young
kids.
Yeah,
Yeah.
yeah.
If you look at Pfizer's study, which was over 60, the result with 17,000 vaccinated people was a decrease of 34 people going to the doctor. It had no decrease in hospitalization or death. 34 people, less
And
people.
it shows
went to the
you
doctor.
how advertising,
Yeah,
I mean, everybody apparently is getting this shot, or
Yeah.
a lot of people, and it really is not, like you said,
effective.
yeah.
300 hours a shot, and the FDA and the CDC both push it, saying the study wasn't big enough to show a reduction in mortality and hospitalization. With 17,000 people,
Has
I knew I'd read it somewhere.
COVID increased or decreased in general the vaccination rate, not just for COVID, but for other vaccines? Has that impacted people's willingness to get other vaccines?
Probably lowered it. They're all nuts. They don't wanna take anything. I mean, you know, it's crazy.
I think there definitely has been a skepticism of vaccine recommendations as a result of COVID vaccine mandates, or whatever you might wanna say. And the side effects that have kinda come out because of it, that were late to come out. I think that has made a lot more people hesitant of vaccines. I don't know from my practice whether that's trickled down into parents vaccinating their kids, of kind of the traditional vaccines that we all had our kids get. But, in the adult population, I definitely see them more hesitant. You know, they'll, if you tell them it's been a tried and true vaccine, like the pneumonia vaccines, they'll get those, but like this RSV, they don't want anything to do with it. Any more COVID boosters, a lot of them don't want anything to do with them. So it definitely has made people more cautious about it.
Do you still have to have all those shots to go to school? Or do they let you go in now?
You can get
You know,
exemptions.
Yeah.
Oh.
Yeah, you can get, I
So
mean, it
they
used to
say
be
you
hard
have
to
to,
do that. Yeah.
to kind of push it, and I think most still do, but you can get exemptions.
Yeah, and I think the exemptions are easier now, aren't they?
It's just, I
just
basically
don't
just,
want
I
them.
don't want my kid to have it, you know.
Before it had to be, you know, like religious
Reaction,
or something,
religious,
yeah,
yeah.
you had to bring a doctor's note in or whatever, now they can pretty much say, yeah.
Thank you. That brings us to old business next. Fab.
Fab, we submitted our annual report, yay, so we're done
Good.
with the first part of the whole Fab, so we are accredited. And then a year later, you had to submit your annual report, working on some of the areas that Fab deemed that you needed to work on. So that report was submitted last week, I think it was, so that is all done. And we're now getting ready to start working on the CHIP part. And the CHIP stands for, the, improvement plan, Community Health Improvement Plan, because you do the CHA, Community Health Assessment, to see what's wrong with your community, and then the CHIP is the improvement plan, how you start improving that piece, and so we'll start moving into that. Probably in January, I think that's our next meeting in January. But that's it, we're on
Okay.
top of that.
Back to 21.
Yay!
Closing in.
Closing in, Carla probably has it up, last I heard it was 23 applications in, has it increased?
24.
24, oh,
Yeah.
since I
For
left.
what?
24 applications in for tobacco 21, so we're gonna.
71?
Out
Is that
of 70.
Yes.
We begin licensing, I mean, they're late, just January 2nd, I guess, because the first is a holiday, right? And, it's not uncommon that people wait till the last minute to pay, because just like they do their taxes, they kind of wait till the last minute. And then we'll just, see, I think Carla was hand carrying some,
The signage. We sent
Yeah,
out second
signage out.
notices, last week. We sent out reminder notices, and we're in the process of carrying out the signage and their, permit to them, and discussing the regulation and where to display the signs and things of that nature.
so we're moving right along. Also, I had sent out an email to the city manager and Deborah, and Ashley, assistant city manager, again to say, are we gonna cap, where are we with that? And, city manager, Paul Lully, said, let's meet on that. Because I think some of the, not confusion, but the last email I sent out was after the board, and I sent your email piece too, is do we have to do any zoning and ordinance or go any place? Because Deborah said we did, you guys remember it was this long thing, that process we had to do. Ashley, when she looked at it, said, no, we don't, since we're not saying they can't go any, we're not making them not go to certain places, we're just capping the number. It might be a direct council, vote, and that would be the city manager presenting it to council. So I said, Paul, where are we with this? And he said, let's meet. So that's where we are with that part. I would love to get it capped A lot of things are going on
I
in
thought we
Butler.
said, I thought it was I thought that was the
We
deal.
never did, did we? We never, we,
Oh,
we.
no?
No, that's
That
what
was
we.
our recommendation.
That was our
and they didn't-
recommendation.
You don't know, they
Right.
didn't do anything.
And it just stopped there, yeah. And the reason why I like to move forward is it's a lot of, if it's a lot of activity in Fairfield and in Hamilton and Oxford, if they're gonna start capping, we don't want Middletown to be the place that we just explode with all of the VIP shops, one. And then two, with the marijuana stuff that they're talking about, and we just need to kinda have some guardrails around us too, unless we just want to become the
Is
place
that
where.
gonna fall under tobacco 21 licensure
What?
in any fashion?
The marijuana?
Yeah.
It shouldn't, yeah, but we,
Okay.
we still don't know.
There's
what that's
just
gonna-
probably additional regulations on that, so there's no need to.
How do they do this? The state says you're allowed to do it. How
To
does
do-
the city say that they can't do it?
They always, cities have,
They
home
have the
rule.
right over
They
the
have a home
state?
rule, yeah, so the state can set standards and you can be more strict. Yeah,
I-
you can't be less strict than the state standards, but you can definitely be more strict than the state standards. So, yeah.
It's
So
the beauty of
250
America, we can live wherever we want and have the rules that we, to an extent.
Yeah.
But the city can't make smoking marijuana illegal, they can just
No,
say you can't
no.
buy it here.
Yeah,
Yeah,
yeah.
so you can't override the rule or the law, but you can say you just can't, you
Right,
won't have a
you can
shop
just
here.
put your own safety guards over around here. You cannot do dispensaries, you don't have to allow that, that's zoning.
There are
You
things
can do
such as
things like
dry
that.
count, but you can drink, you just can't buy it,
You can't,
right,
right.
right, mhm,
Right.
right.
Mhm. So that's where we are with tobacco.
Okay. New business, travel authorizations. I don't think there were any, huh? Okay. Are we actually voting on the pay and benefits ordinance? Okay. So we have ordinance number 2023-03 and 2023-04. Do we have a motion to read these by name only?
So
All in favor? All opposed?
Got it, Jen?
Okay, so as far as ordinance number 23-03, pay and benefits ordinance, do we have any questions about this?
Yeah, I don't know what the hell it is. I mean, I looked at that, I have no clue
I
in the
know,
world what that
okay,
is.
so let me see what I can do real quick,
I
and
mean,
then
you
Mayor
can't
help me.
believe they got a bunch of
I'm
them.
glad,
Yes.
I'm glad you're willing to just say, what the heck?
What the hell
I
is
mean, if
this?
you,
Okay.
it's okay, I don't guess I have to know, but I
Let me
mean,
see, no, it's
certainly-
kinda, yeah, and let's talk about it. So this is how the city does their pay and benefit ordinance. They have always done it this way since I've been here. What they do is the city kinda decides, it's a small committee that meets, the pay and benefit ordinance committee, and it's the legal team, it's HR, and just city managers, and they look at everybody's salary across the organization supposedly, right? And they decide where people are to be. These are ranges, and a certain range is associated with a pay.
Okay.
So we have a pay scale, so, and if you see, when you see this in the packet, the dark, or if it's scratched out, or the dark is new changes. And so, and this is what we're giving out, and this is what council approved too, this is in the budget packet. And so the whole city has a budget, and then health department has a separate budget, and then courts has a separate budget. The health department adopts the city's policy.
Would it-
Yes, so
If
yeah.
the numbers are lower, does that mean that it?
Yes, and so now, the lower your number, the higher your pay.
Oh. I was gonna
And,
say the lower the number, the lower the.
yeah,
oh, okay,
that's the
so it's
confusion,
not
because we had
completely
another scale that was the way you're thinking. And so this year, all the delay, confusion was because they were merging two pay scales into one. And so now we're into this one, so if you're a 178, you might make $100. If you're a 176, you might make $200. When you go down, your pay goes up.
But they had 178 dash, let's say the third one, or the top one.
Okay.
184 dash 246, now it's
Yeah.
184.
Right, so you remember, the ones that have the 200 numbers, that was the old paid schedule that they completely eliminated.
Oh, so that's all,
Yes.
just now, that's. so
Just this year, that's,
This
yeah.
year, so
yeah.
those are all gone.
They're all gone. And so now, effective 1/1/2024, everybody's on this 100 pay range
Okay,
schedule.
well,
Yeah, so it made it simpler.
Simpler.
Mhm. Yeah, and keep asking those questions, cause I'm trying to explain them too, cause I mean,
Well,
yeah, because you kinda get confused. When we were trying to, it was crazy, cause people that were hired after 2018, correct, were on this 200 schedule. So it was very difficult if you had an office with mixed employees, because there were different scales, different increases. When they get their step increase, different percentage increases, it was hard. And then you were going up the scale on some cases, and then down the scale on another place, and it did make it kind of.
Wasn't it difficult to do?
Very difficult, yeah. It was very difficult, yeah. That's when you get different, that's different leadership and different thought processes and.
We had a salary study, we paid for a salary study.
What'd they say?
Depends on how you read it, that's
Oh.
not what I like to.
Okay, whatever.
Yeah, and I think the mayor did a good job when she was saying, when you do a salary study, you really have to try your best to compare apples to apples. So you have to do a lot more research than people give you the salary study, and some of that is,
Yeah,
like-
benefits are in there, right, and so you can't just look at like direct salary to salary, because the benefits are a part of the package, and it's just not, you can't really compare unless someone were to say, the benefits are worth this amount of money, add the salary, but no one ever compares those two numbers.
Right, right.
Because also to someone else, this, like, that benefit may be worth more. Right, I mean, there's a financial value to it, but there's also how much do you value paid time off and
Right.
health benefits too, which you could argue is not a direct monetary, I mean, it is,
Mm-hmm.
anyway, yeah, so.
And public health, when we do our salary study, which we do every year, AOHC, the Ohio Health Commissioners, when we do ours, our questions are just that. Is your health commissioner full-time or part-time? Do they have benefits? Do they have a package? Do they get PERS? Do they get, all of that is included in there. So it's just salary as far as dollar amount, and they say the low side and the high side, right? Because you can start at one point and you top out at another point, but each year you may get cost of living. So, and then they have, do they get vacation? Do they have a car? All of that are different in the package, and so our salaries are that detailed, as well as all health departments are different. We have sanitarians, our sanitarians here in Middletown have to be sanitarians that do everything, tattoos, swimming, pools, septic, everything. So ours is, I don't know if we would call that a general, because they do everything. Some health departments only do restaurants. Like Butler County might have all of those restaurants in Liberty and all over. So they're doing only restaurants, they're not doing sewers, they're not doing septics, you see what I mean? And so you have to look at the different areas. So health departments do a good job at their salary studies that we do every year. And most people, it's not required, but it's almost 100% of health departments that put that numbers in, because you gotta tell them, you know, you don't have to participate in the salary studies, but they like to know where you are, and, you know, it's hard to keep stealing staff. And that's what happens, you steal staff if you are all over the place with your salaries. And so, yeah, so that salary study was conducted, and that was another thing that was kind of thrown into the whole piece. And so we always, if you look at your December agenda, at the end of the year, we're always passing our budget as an emergency in December, because we wait for council to approve all of it, and then we just adopt what council approved. And so we can't do that until council does it, and so we can't do it ahead of time,
And it was late this year.
yeah.
Okay, any other questions on that very cut and dry pay and benefits ordinance?
You might see another thing too, they took out that health commissioner needs a bachelor's degree at 1 year. Leadership said that any department that had a bachelor's degree got more money, master's degree got more money. It was steps, jurisdiction, if you're attorney, it was in there. They took that part out. and they left in the master's degree part. But in the section of the rest of it, we don't get a car. It's like, Oprah, you get a car, we don't get a car. Yeah, and I think everything else pretty much looks the same. But again, if you have, oh, and last other thing I did with the workforce development as well as, we gave Carla a new title. And every health department pretty much have assistant health commissioners. We can't afford a whole nother person. So we gave Carla environmental director / assistant health commissioner. And that allowed her to have the title of assistant health commissioner that could be able to do some of the other things. That's why it's bolded there. That's the only position that we changed in there. But that's it. Yep, you had a question? I thought you
I
had.
was gonna say, I know why Paul does his job, it's for all the money he's making here.
Oh.
It's the money.
It's always for the money, you know, so I think that's it, unless anybody.
Okay, with that, do we have a motion to approve ordinance number 2023-03, the pay and benefits?
So approved.
Second. All in favor? Aye. All opposed? Okay. Now we have ordinance number 2023-04, the health department budget. Any questions on that one?
Let me ask if I read it right.
Okay.
It's losing money, but I mean, the projection for next year comes in at a loss, but you have
The beginning
a gain,
balance?
a beginning balance of this year, so that will cover the loss for next year. Is that
Yes.
is that right?
Yes,
Okay.
and if you look at the budget over the years, the health department, like every department in the city organization, except for public works and tax, lose money. The health department is the only one that gets subsidized. Everybody else, I mean, every other department does not pay for itself. And so usually we always get subsidized with public works money because we do a whole lot of septics and sewer stuff, and we get subsidized by city income tax. And over the last COVID years, we were not. We weren't, we were just eating into our surplus, if you will, because the health department and courts carry over their balance every year. We don't
So
spend
that's-
out.
But that
Yeah.
was how, correct?
So that's how it, yeah, so that's how.
Any other comments or questions? I'm sure everyone read every word and number. Okay, do we have a motion to approve ordinance number 2023-04, the health department budget?
So moved.
All in favor?
Aye.
All opposed? All right, both of the motions passed and the ordinances passed. That brings us to the 2024 Board of Health meeting dates.
Those are just presented to you. You know, we meet the second Tuesday of every month. For some reason, if there is, we have the council, we still have to meet within the month. So we'll get a quorum up and meet within the month. We have never not met, but it could be for, you know, what do you call it, winter issues or whatever, or terrorist stuff or what. There's no telling what's gonna happen in the future. So those are just packed. So if it's the second Tuesday in your month, 7:30, this is where you need to be. This is where the party happens. Yes. So those are just presented to you. I know, right?
Okay, that brings us to board member topics. Anyone have anything for open discussion? I know one thing I was just emailing about yesterday were food trucks and food courts and where our regulations are on that. I thank you guys for getting back. It sounds like from a health department perspective, we have a maximum length of, I don't wanna call it stay, is that what you call it for
That's
food
what-
trucks? That's what you call it for RVs, but I don't know. Anyway, of 40 days?
You can stay at any one location for 40 consecutive days without moving.
That seems really long to me from a sanitation perspective, but
Mm.
I don't know. I was trying to look up what exists elsewhere and I have no idea.
If it's what?
For
What
sanitary.
exists, like, I don't
Oh.
even know.
Yeah, that's,
let's bring everybody up to date. We were talking about
Yeah, thank you.
food trucks, and on Brill Boulevard is, I think this person purchased the lot. I think that's where, in my opinion, that's where it starts, because they
That's the
purchased
Wendy's.
a lot right in the middle of food heaven, right?
Yeah.
And then they're gonna do food trucks there, and food trucks are, it's almost like, in my opinion, when you do that, when you operate like that, it's almost like cheating in a sense, because you don't have the overhead, you don't have, and so that's where some of the concern is, how long should they stay there? And the ordinance, and Carla stopped me, because Carla knows better than I do, it's vague, right? I mean, they said without moving could mean from here to there,
Yeah.
right? I mean, and moving could be, you can do 40 days, be off on that last Sunday or Monday, and then operate for another 40. So it's this, so that's when it's important that your zoning and your other things come into place to supersede those statutes that's across the state, because that's why, that's our code. And so, to me, that's why I said it's pretty much zoning issues. I would not have let something be in the middle of other things that look like me, right? It's like if you're in a, like, and you have to
Right.
do all this stuff, and I can just come in there
There's an aesthetic
and-
piece to
Right.
it as well. I mean, obviously.
Yeah, and so that's some of the things, and whether, I mean, that's where the confusing part, because I kept going back and forth with Carla. I always like to spar with her. So what about this? Well, it's not fair with that. I always like to make sure that you're touching all of the areas that you need to touch, right? So I always say, and Carla's like, Jackie, we can't do, the law says, I said, but what about this? But, because that's what people are thinking. You work really hard to get your rent and do things that you have to do.
Well, I don't know that I mean, yes, that's important, but I think there's, from a zoning perspective,
Mhm.
there are, well, certain types of businesses
Mhm.
allowed in certain areas, right?
Right.
And so we will, as a city, wanna make sure that a mobile food truck is something that, like, is this area, does it allow restaurants, for example, right?
Mhm.
Or outdoor dining, okay, that's
Mhm.
one. But then also, if, let's say what if these mobile food trucks pulled up in a historic district?
Yep.
Can they sit there for 40 days looking like, there's no regulations of what they look like, right? Nothing has to be approved by anyone, so are we, and I don't know,
Right.
maybe the zoning code doesn't allow that. I just started wondering, because there's also a sign over here, as you pointed out, that says food truck court coming. That's what it's painted on the side, Molly's
Oh,
Cafe
painted.
and food truck court.
Oh, see.
Yes.
So
I
they're gonna
know
put,
that.
yeah.
I just know she asked me about a restaurant. I don't know anything about a food truck,
So
yeah.
and then.
And I think in the ordinance, and I haven't read it recently, but I know one time we had a guy that just put a wooden sign up, and I think they, in the ordinance, they changed it where you had to have an appropriate sign, so there may be some
There is
guidance.
a wooden sign up at the one on Briel, which I highly doubt is in line with our sign code. Like, did they get approval for this? I don't know, they're just
Yeah,
all
I don't know.
questions. I'm
Yeah,
I'm
yeah.
like, because they're starting to become just more and more prevalent, and I feel like in the absence of appropriately identifying regulations, we could get overrun, and then they'd be grandfathered in, and then not applicable. So, that's why I just brought it up.
And
Also,
that-
from a sanitary perspective of restrooms, and where are they dumping their gray water, and what, because if they're not
They're
moving every
supposed to
40
take that-
days,
Yeah, well,
where are they dumping that? I mean, let's be realistic about
Mhm.
that.
Yeah.
Mhm.
I lived in an RV, and I know there is no way you're going 40 days without dumping.
Mhm.
So where is it going?
See, and another thing too, restaurant rules and food truck rules, two separate things, but you're
Right.
behaving and you're looking like one, right? And so that's why I think it behooves, and I'll say this again, it makes sense for health department and zoning, those departments to sit down and talk about things and kind of get it in sync with each other, so that you're at least saying, well, we can prevent this, we can prevent that, well, is this allowed? Because every different thing has rules.
So at the moment, though, he's there and there's no rules, or there are rules, but we don't know what the rules are, or
Well,
what's
in
happening.
the sense, yes, because remember, food trucks have to be licensed where they live or where their business lives. So we may not even license the food trucks that come over here. So we have no say-so over what they
Oh,
do.
he could come from, say,
Any place in Ohio.
Lebanon or something.
Any place in Ohio.
So he's licensed from there.
Absolutely. And we don't get any revenue
That's the other
inspecting
piece.
and monitoring
Oh,
and
that's it.
managing out of our city limits, right? Food
So
trucks.
whose responsibility is it to inspect?
Whoever licenses them.
Well, they're not coming out to
Yeah,
Middletown to
well,
inspect.
there we go.
Right, we can inspect them. We have the authority to do an inspection, and then the inspection report would go back to the jurisdiction.
On our own dime.
That
But
receives the money.
if they're, I mean, we have no way of, taking action on their license, and that's when community development would, they have the more authority on those mobiles that live outside, that are outside our jurisdiction.
Cause a zoning
that-
piece probably could say,
Yeah, yeah.
if you're not managing, if you're not having the correct sign, if you're not keeping up, if you're not doing your wastewater. See, I mean, they can have the teeth, because you're not allowed to come here and be zoned here and be here. We don't have the teeth to do that, cause all we would do is send that report back to their home entity that licensed them.
So what Development Services said in this conversation was that if there's no existing business on the property, that the food truck operator must apply for a certificate of zoning to verify that the district allows outdoor dining. Which in this case, the one on Briel had applied for that and received it from our Development Services. But aside from that, they're good. I just think we
I would
probably
be-
don't have everything in place that maybe we need to consider. I'm not, no one's fault, it's just like something that's
Right.
developed over time that we could easily, and the historic district is a prime example. I only say that because it's the most restrictive of like buildings and what you can do to them. And then there's no restriction on a trailer, what it, I don't, from a, like if somebody had a food trailer that was falling apart, but complied with health regulations in some fashion.
They're allowed to operate, unless somebody, health department can't say you have to be pretty. You just have to be
Exactly,
pretty.
right.
And there are
that's where
some
I'm
that are
coming
not pretty.
Yeah.
We can go out there, we can do inspections, we can tell them, hey, you have to move at least every 40 days. And you have to make sure that you take your waste with you, and you can't dump, but
Right.
what, yeah.
But again, you don't know, when you say move, I mean, he can move off
An inch?
for a
Yeah.
day, well, or even move off the place and come back the next day or whatever needs to be.
But at least, so that does though keep, like from an RV park perspective, they do that so you don't start like building decks on site and creating trash and debris. And you also have to unplug, and everything has to like go through the motions, which actually keeps things mobile.
And
is what it's
they
supposed to
do,
be.
I know, the gentleman that owns that property, he's been to events. I see him in Cincinnati, I see him in Middletown.
So he is moving.
He does
Okay.
move now, every 40 days.
And 2 trucks,
And, yeah,
one
2
truck might
trucks.
move, but
Yeah.
the other one might.
Yeah,
not.
I haven't
And-
paid attention to.
Yeah,
whether
and
they've
the
moved
lady,
it.
there's a Mexican mobile out there, she has her license, she's been at events in Middletown as well. So they do move,
Mhm.
but.
And I'm
yeah,
I'm
I
happy to
don't-
have food trucks,
Yeah.
and I think it's a great business. I just wanna, I don't know, it just brought to mind, like, do we have everything in place?
And we've
Especially with
actually-
this little thing over here, like that
Yeah, I know, and we've
is
gone out
like
on one complaint initially, I think when they started out there, but it wasn't anything that we responded to it. So it would be respond, based on a complaint and we would do an inspection.
And did you find the food truck ordinance a long time ago, when we started with the DORA, they created something, and it was, if a food truck wanted to come downtown, they were allowed to come downtown under an entity, like under a festival, like if we were having arts festival, and then food trucks, as long as you're under that. And if they wanted to come downtown, they would have to get, Carl, wasn't it a license or something? It was like $75, it was, or it was something. And that was a while ago. That was when Les Landon was here, that we created some food truck ordinance, but that's all through zoning. I think it's upstairs in zoning. It's not the health department, we were participating in that, but that was for downtown. Because right now, food trucks can go into private property, like on the gas station down there, that's not ours, but down at Ingles Corner is a food truck that sits there at that gas. So they can go on private property as long as they have permission of the gas
Right.
station or whatever, and operate there.
Well, there's one on Grand, the BP, at least part-time or
Oh, really?
sometime.
They can
Yeah,
see?
right there.
So as long as so they can do that at different places. They used to have one on Lefferson, a truck that was over there on Lefferson. But they're not allowed to go throughout the city. I think that ordinance said they're not allowed to go in neighborhoods. And
Yeah, they
were-
did say no residential.
Yeah. So it did have some guidelines there, but I don't know if anybody is using them or, because we always tell when people come in with a food truck license, we always tell them that this license affords you to operate any place in the state of Ohio, but you must check with zoning in those places. So
Sure.
just because you have a license to go everywhere, something may be zoned where you can't park there,
Right,
so.
okay, well, I don't know. I just think it's hard to enforce the health aspects when we don't even certify most of them. Well, I don't know, maybe we are, but there could be, we could have not a single food truck in Middletown that our health department's ever looked at, and who's inspecting them if they're not even in their local, like, if somebody got inspected here, they never have to be here, so how do you ever re-inspect them?
Say that again?
So like if somebody got inspected in Middletown and they live here, but their food truck travels all over the state and is never actually here.
They're required to get one inspection a year. So we inspect them at least once a year. And when we have events, we do inspect the out-of-district mobiles, yeah.
Yeah.
We try to look at them too when they're.
Okay.
What I think would be a good idea is whoever allowed them to be there, whatever department, make sure they know what the rules are. Because that's where the teeth is. Now that you're gonna be out
Yeah.
here, the zoning piece, you must get rid of your waste, as I would question them first, how do you get rid, I would want them to tell me, not just say, you gotta do this, and they just shake their head, yes. How do you get rid of your waste? How do you, get rid of, and let them tell you what they do and say, you know that you have to do this. You can't put the grease down the sewer. You can't be, yeah.
Right.
I think that would be the department, that's the health part, but that would be the people that let them be there to make sure they're following those health, safety. Because they then could say, if they found out they were dumping, if they found out they're doing something, they could say, it's not allowed. See what I mean? They have the teeth to do something.
And that's one reason why they have to get licensed primarily where they live or where their business is or a commissary, because once they license, they're usually not in their home,
Mm-hmm.
at their home base, so that's one reason why they have to get licensed.
Okay.
And just FYI, if they said where they live or where their business is. If they no longer have a business, Carla told me that their license is still good until the end of the year. And then when they resubmit for a new license, they have to do it again where their business or where they live. So someone could come in here and have a business in Springdale, and they get licensed in Springdale. But then their business closed 6 months later in Springdale. Their food truck license is still good to the end of the year, but when they resubmit, they can't say that they're, they shouldn't say.
What if someone comes from out of state?
They have to get an Ohio license.
They usually with the first location where they are, they usually get licensed, like Carnegie people, that's not derogatory, but if they are going throughout Ohio, they usually get licensed, try to get licensed their first stop. We've had that occasionally.
Does that make sense?
Yeah.
We follow food complaints. If it's any food complaints or illnesses, we still would follow up on that. We still do that regardless.
And we can follow up with him out there as well, just to make sure he knows. Which he should, because he has been licensed
The
in
city may
Middletown
issue
before.
no more than 50 at a time. I didn't know there's a cap on that.
Food trucks.
At one location, or what?
It just says at a time. What that means is, I don't know what a time means. Is that in a year? Is that in?
Right. Season,
different kind of health topic that you have answers to. Okay,
I do have one other topic.
Okay.
We may be revisiting syringe exchange. It's new council, new thoughts, it may or may not fly, but people have approached me saying, now that you have a different council, do you think they would be interested? Telling you where my stance is. Harm reduction, I always believe it's important as far as clean needles and Narcan and all the rest, but I was willing and feel strongly that other municipalities need to step up and help out with this whole initiative. And so I am still hesitant about putting anything else in Middletown unless other places put it in there too. And so, but I think if they wanted to, remember we had overdoses, a lot of overdoses. We had 5 one time in Middletown, 4 in Middletown, 1 in Hamilton, and then next weekend it was reversed because I think it was bad drugs going around or whatever. So I'm not opposed to entities like the library or whatever giving out Narcan or information about overdosing or whatever. But as far as right now with needle exchange, we're still on a county-wide basis talking about how we can help with the issue. I mean, so.
I did approach the library about Narcan.
Okay, good.
They have Narcan on site now, but it is going to be distributed by, the case manager that is there in afternoons.
Okay.
So it's not on display, but there is somebody there who
Okay,
can
good.
distribute and teach
Good, good,
how to
good.
utilize it, yeah.
Yeah, cause I've given all the county, like libraries, Narcan for their staff, just in case somebody went down while they're there.
Yeah.
It wasn't for
Yeah, and I approached
distribution,
him
but-
about the distribution
Okay.
because with the syringe exchange being
Right.
gone and those overdoses that happened in
Right.
October,
Right.
a lot of those individuals who utilize the syringe exchange are going in the library for services and shelter, so,
Yep.
yeah. So hopefully can catch some of them in the process and at least get them back.
So I think that was the only other thing I had. Eclipse too, that's just open discussion. Everybody's talking about the eclipse, April 8th, I think it is. They said we only have 1 minute and 52 seconds, but I think that's enough to burn your retina. So we're gonna we're probably gonna start getting information out as we work as the countywide EMA or whatever to get that information out, eye safety and different things. A lot of people are in that direct, it's called something, what is it?
Path to
Shonda?
totality.
Path, yeah, of totality, so it just comes, I think we just get a little bit of it, but as you go up northeast, I think gets more of it, I think in certain areas. So some health departments are very involved, but just be mindful of what they're concerned about is campers, campgrounds, traffic, people coming out, and so some people are,
What is the concern?
with a lot of people coming to see it. Now, people think this may be crazy, but a lot of people follow the eclipse when they come over. I mean, they come from all over the United States and they'll kind of get into your communities and they'll push out. So people camp and they get into the hotels or whatever, cause it's an event for a lot of people. And so other places say that they've come and they need extra
Tourism.
bathrooms. Yeah, tourism, yeah, they need extra bathrooms.
They need
And
food
it's-
trucks.
Yeah, food truck, yeah.
All the food trucks that week.
50 of it.
Yeah.
The Butler County Emergency Management has come to the schools, all the Butler County schools
Yeah.
have closed that day.
Yeah, all of them are closed.
Because of the concerns over traffic.
Traffic.
The timing coincides with getting out of school. And we're on the southern edge of the
Mhm.
band that is gonna be best to view it. So their concern is that a lot of people are gonna be coming north to see it and are just gonna pull over on the side of 75 or the country road or wherever they go and create a nightmare for buses, is the concern from the school side.
Right, and also, you don't wanna be in
And
charge
the
of
hotels
kids.
are all sold out,
Yep.
supposedly. That's what they told our school district, was all the hotels in this area are already sold out for April 8th.
Yep. Yeah, it's a.
The emergency management has concern over how chaotic it's gonna be that day.
Okay.
So, yeah, I wanted you guys to be, we're gonna just do a lot of research as far as our, like I said, eye health, because we don't want.
I mean, think about that, if you're on I-75 and it's busy, people are definitely gonna be slowing down, pulling over. I mean,
April eighth?
For a minute and a half.
April Monday, the day
For a
before
minute and a
the
half, it's
next
gonna
board.
be
April
April
eighth.
Crazy.
board meeting.
April eighth, I wanna say it's.
3 o'clock or 2?
Like 3:08.
Yeah,
It's, yeah,
yeah.
we're gonna be,
Okay.
we're gonna be in total darkness for about 2 minutes.
Which will be pretty cool in the middle of the day, but we could have a snowstorm. We could
Yeah,
have
except it'll
anything.
probably rain or something.
We could have the perfect
Every
storm.
time you have some kind of weather
It'll be an
Yeah.
April shower and we'll
Yeah,
see.
or whatever.
But it'll still be dark.
Yeah.
It'll still be dark.
Oh.
Okay, but so this is the old mama and me. I think we always need to be mindful and prepared, even if it's nothing, you should know about certain things. I mean, because that's as soon as you blow off something, then all
Yeah.
crap hits the fan. So just let you know, we'll get information, we'll keep it in the packet, try to do whatever we can. Someone said, can the health department, because of eye health, could the health department buy glasses for downtown business owners? And I
No,
said,
they'll
well,
buy their own.
you know, I said, well, we would have to provide it for the whole community, not just for
No,
downtown
yeah.
businesses. So, to be continued, but, I just wanted to put on your radar, and then you'll just have some information in your packet.
Great.
Yeah.
Okay, great.
Yep.
Well, Health Commissioner report?
2 things for me. Mayor Nicole is leaving us. This is her last meeting. So.
With this meeting time, I'll be back all the time.
She looks nice.
I know, you're gonna be here okay, so
She
we
looks
she has to
sad
be
about
here
it.
at 7:30, cause you remember, 7:30 in the morning.
Uh-huh.
And so this is your gift from,
Oh,
from the Board of Health.
well, thank
And we
you.
wanna thank you for your service, and really and truly, being on any political body is difficult. I look at you two, school board person, and so, we appreciate you, all that you've done, all, how you showed up in the community in Via. You worn out your poor dog, and, anything that we can still do, you know about how the health department runs, so anything that you hear, just continue to be the good public health partner that you've been. And anything that you need from all of us, constantly feel more than welcome to still reach out and whatever. So we appreciate you and
Thank you very
I love
much.
you.
Thank you guys for your willingness to serve on a board or commission, because I know you all show up.
Yeah, they're the best board in the city.
Yeah.
They can't, other
It's a
boards
lot.
can't even get quorums, and you guys are always here at 7:30 in the morning.
True,
Appreciate
true.
you. And the last thing on that vein is Mayor Elizabeth Slamka will be joining us next board meeting in January. So we'll be, all these new council people are getting orientations now, but we'll do an in-depth one before January, before she comes on board, and so she will be in the seat next year.
And she said she's a bakery person, so she's cool with the morning hours, so I expect her to be a little bit late.
Yeah, good
Talked to her
point.
about that, I was like, the Board of Health is 7:30, she's like, I love it. I'm like,
Is it?
okay.
Well, she can bring the donuts in.
I was gonna say.
But that's, okay, and that's it. I pretty much did my report throughout, so that's all that I have. So thank you so much.
Thank you.
Appreciate you.
Dr. Genowine.
Reportable illnesses, we have 18 chlamydia, 7 gonorrhea, 6 hepatitis C, 3 hepatitis B, 1 syphilis, 1 HIV, 1 pertussis, and that's pretty much it.
Thank you. Chandra.
Jackie already told you about the eclipse. Part of being in the emergency preparedness position is also working closely with EMA. And we probably spent a good hour talking about the eclipse at our last Butler County Public Health ESF8 planning meeting. It really, for the general person, it's gonna be 2 minutes of, hey, let's find a way of looking at this eclipse without burning out our retinas. But for the county level, it really is a big deal because mostly for the traffic safety, the food service and sanitation, Butler County is predicting that they're gonna easily double their countywide population on that day. And that's,
Such a hard time believing that.
it really is amazing, and they learned a lot from the last eclipse, and it went through rural Kentucky, and they literally had farmers opening up their fields to host these giant camping parties. So there are temporary campgrounds getting applications in. It's gonna be a lot. So hopefully it will go smoothly, but there's a lot of plans, going into this. So I will keep everybody posted on that as well as we plan out more.
From an EMA perspective, they did put a bulletin out, the things specifically that I'm like, what?
There
For
is-
businesses, be prepared for more cash transactions.
Yep.
It's, yeah, I mean, there's
And
gonna be a lot.
Cellular service could be
Bogged
bogged down. What's the other one that they put in here that I don't know. Oh, gasoline.
Oh, yeah, there's a gas.
before.
Are we gonna be able in this vicinity to see it
Yes.
clearly? Is that why?
Yes,
Yeah.
that's why it's such a big deal. So, for that 2 minutes, we are in that path of totality, which is when you don't see just the little slivers. You will see that full ring of fire around the moon. So that's why it is, people will stop on the side of the roads to watch it. I mean, people stop when there's a partial eclipse, people will stop. So that's a big traffic thing. That's my biggest thing is it's at 3 o'clock in the afternoon. That's why schools aren't gonna be there, because they don't wanna worry about those kids. How are they gonna get home? Where are they gonna get stuck? Are there gonna be wrecks? Things like that. So, yeah, we should be able to see it as long as it's not a stormy April day. But again, even if it's a stormy April day, it will end up being dark because for that roughly 2 minute time span. Kinda neat. I've
Yeah.
already ordered our glasses for the office.
And at 3 o'clock, think about it, 3 o'clock, it should look like this outside,
Yeah.
even in the winter, so it's gonna be completely dark.
It'll be a neat
It'll be
event.
April though, so it's already.
Right,
Maybe.
but
It's
again,
already
but I
great.
said-
It's April.
Yeah.
No, so it's good.
Yeah, but I said even at 3 o'clock, even in the winter, it should be,
It should
it
be.
should be, outside, so that's
Yeah.
what.
So that's one of the preparedness things. I'm working on, just meeting our other preparedness grant deliverables, our training plan for the next 5 years. That's our next deliverable due. There's been a few cases of pertussis, in the city, amongst children 9 and under. Some of them, a couple of them were actually our residents, a couple of them are going to our schools. So they're Warren County residents, but they attend our schools. So, but they are all one-offs. They're not related, they're just isolated cases, and there's not been any further spread in the schools. Other than that, it's.
What do you do with those kids?
The kids, typically they get put on their antibiotics for 5 days, and as long as they're feeling better, they're fever-free, they can go back to school.
Oh, so it's,
But, they're out for a week. And most of them are perfectly fine. It does, obviously, it does affect the younger kids more severely, or the immunocompromised. I had a pretty sick, just a lung health kid who was pretty sick, but he's fine now. We had our first influenza hospitalization reported this week, so it's technically a December number, but it is here. Just not in overwhelming numbers, but it's definitely something to keep an eye out for. Other than that, just working COVID cases as well.
No, I
Okay, Carla.
We received plans for, Common Grounds Coffee Shop, which is at the high school. They have a coffee shop for kids with disabilities and good ways for, them to learn how to handle money. So we're looking at plans for that facility. We have another, Pat Worldwide micro market. We're reading up plans for that. Sunoco on 5013 Lefferson. We have 3 gas stations on the corner of Lefferson, so we've received plans for those, for that facility. We approved plans for a permanent makeup facility, which will be located at Masters Touch Hair Design. And we licensed Brant Distilling, which is on Roosevelt. Big Coffee, which is now open, we licensed them also a couple of weeks ago. The other gas station on Jefferson is called Arco Food Mart, and that's on Jefferson, we licensed them. And I believe I mentioned All Hustle Tattoo, which is on Oxford State Road. I believe that's it. We just Sarah and I are just trying to keep up. I'm actually out in the field doing inspections and licensing. We're actually gonna advertise for specialist position. Again, this will be the third time we're advertised, so hopefully we can start interviewing sometime in January. So we have a few applicants, only one applicant currently is a training, sanitarian and training. So, and the other ones just have degrees, but no training. So we were actually trying to hope to get someone with, that was trained. It takes about 4 or 5 months at least to get them on board. So if not, I guess we'll just have to train.
Did you mention that we're gonna advertise again with the new salary?
With the new salary.
With the new salary,
Yes.
because that may, starting in January, it'll be a new salary, and that may, because I think Hamilton is, what? I think ours starts at, the new
47.
the new salary starts at 52, Hamilton starts at 58. And so, and almost every health departments are looking for, environmental health specialists.
Only you're looking at the salary.
Yeah, they did, look at that. Hamilton didn't give them, they said Hamilton did not give them their salaries. And I guess they didn't do the digging and the research that they could do online, but, yeah.
Are any of the applicants bilingual?
No.
Oh, that would be wonderful.
Yeah, that would be. I had to use Google Translate yesterday. I actually went to a facility and they did not speak any English, so that helped a
Oh, yeah.
lot. I use that a lot, so,
And our
it
food
works.
trucks, Carla, have been, most of, last 4?
Yeah, have
Yeah.
been,
Mhm.
yeah, Spanish speaking, so, yeah, that's it.
Hola, that's all we know.
That's okay.
At least we're friendly. I don't
Yeah.
Sí, señor.
Anything else?
Oh, that's it.
With that, we will adjourn the Board of Health meeting until next one being January 9th, 2024. Merry Christmas, Happy New
Merry
Year.
Christmas, Happy New Year, Happy
Thank you,
holidays.
everybody.